our Corporate Anchor Roundtable is an opportunity for us to learn how our colleagues and the institution overall is serving the needs of our communities beyond usual medical care. I think by now many of you know that I am passionate about our organization being an anchor institution in that it is concerned with things far beyond the conventional platform or menu of clinical care. People cannot be healthy if they're chronically unemployed and cannot be healthy if they live in an environment where there is insufficient economic development. Environments like those go stale and otherwise fall into disrepair and further burden those who live in such areas with lives that are not enjoyable and certainly not healthy. I am very proud of our organization for having led the way in establishing what I consider to be the need for healthcare institutions like ours to be anchor institutions, to go beyond just the simple duration of time of existence in one place and to truly become integrated in our communities. And I would suggest something that I know you all know, but we need to keep top of mind. Anytime we do something in our community, anytime we start an initiative or make a contribution, irrespective of what that initiative may be, we are further, I hope, building trust in our community. We are expanding our relationship with those who live in our communities, and that inures to the benefit of all those who live in our communities, as well as ensures, as best we can, not only the viability, but the prosperity of our organization. For those of you who may have read the pre-meeting material, I was struck, and I must say I wasn't particularly happy with one of the articles, which implied criticism for those of us who are attempting to address the social determinants on an individual community person basis. And it rightfully called for more policy making across populations to ensure that the social determinants are in fact addressed. I have to say, I have no quarrel with the goal, but I am not particularly fond of the notion that there's a strong suggestion that we ought to stop trying to do it individually and insist that population-wide policy gets adjusted. I wish we could do that. I wish we had the opportunity and the authority to legislate the kinds of policies that would make some of our social platform unnecessary. For those of you like I who've been involved in conversations with people from foreign lands where they have national health services, we are frequently asked, why is it that America spends so much money on healthcare and the results aren't as good? And my standard answer, with some explanation, is that every country that has a national health service has a greater social platform supported by the government. That, frankly, is the message in that particular article. We can do very little about that. We advocate for that, and we try to get policymakers and elected officials to address that. But for the moment, until all that gets done, our role as an anchor institution caring about the total lives of the people who live in our communities is imperative. At least I think it is. And so I want to thank all of you for that which you do in that regard and how you support not only our mission in general, but specific our anchor institution profile. And I encourage all of us to continue to do that as we learn more about how we can help our communities in that regard. So again, thank you all for participating. And Diana, thank you to you and your team for putting this together. Thank you.
Thank you, Barry. Appreciate your comments. Next up, we will hear from Mark to provide some introduction. There you are.
Yeah, thank you, Diana, and thank you for your work in putting this program together, and thank all of you for your work and dedication to our mission. I have to just by way of introduction share with you how humbled I am by the opportunity I've been given to succeed Barry. You know, it certainly big shoes to fill in many ways. The fact that I have to follow him in speaking engagements like this is always terrifying, but I'm thrilled to be here today. You know, our mission to make our communities healthier through clinical programs, social programs. Prominent among them, of course, is our anchor mission work. I believe that this is an inherently noble endeavor, and I can assure you that as we move forward together, that our mission shall not change. I am incredibly humbled by the work you folks have done, by the work that we're doing, our market leading work in connection with health equity, our focus on social determinants of health, our work in diversity, equity, inclusion, our work in ending racism. And I think that I want to assure that the folks who have dedicated their careers to this, that our market leadership with support from the top down will continue in this area and all the areas I've talked about. And I look forward to working with all of you in connection with this activity. This is my second time participating in the roundtable. It is always a highlight of the day for me. The work is incredible. Keep up the good work. Thank you. And I look forward to hearing the program and again, being a forceful advocate for this mission-oriented work that we do. So thank you, Diana, and keep up the good work.
Great. Thank you so much, Mark. So just a few comments before we get started with presentations. As Barry alluded to, very thought-provoking article in terms of the supplemental reading. I just want to say, as an anchor institution, we do really get to create an impact in the communities that we serve, right? On an individual basis, but the focus on the community as a collective is what really drives the longer term impact we seek to address. This past quarter has been a lot of fun working with the IT team. We might not be a technology company, but as an anchor that's really trying to be innovative and leverage all of our human and creative capital, we have found, that we really need to rely on all folks, including our technologists internally, to develop some of these solutions to increase our local procurement. So you will hear from that team in collaboration with supply chain. We also want to make sure that we're highlighting, individual stories at the local level. So that's a bit of a new design format for this Corporate Anchor Roundtable. So we'll be hearing from Monmouth Medical Center Southern Campus on their laptop donation program, as well as from Human Resources. We're going to hear a testimonial from one of our students that completed the medical lab technician program. I also want to shout out some of our guest attendees today that we have in the house. I saw some folks from Trinitas already, so welcome. This is their first Corporate Anchor Roundtable, and again, we're trying to level set and integrate them as well as possible into our anchor mission and our social impact endeavors. We also have our social impact leads joining the call, and our regional VPs for finance. And I think it's super important that they're joining this call so they can learn about, how the IT and supply chain folks are working to really increase our local spend. All right, so with that, I will start sharing my screen. Give me 1 second. And next item on the agenda, we're actually going to jump into our New Jersey CEO Council initiative. We wanted to make sure that we're providing folks an overview and also a glimpse as to the progress to date we've made with this initiative. So Dr. Alexander, if you could jump in. You may be on mute. I can't see everyone on the screen here as a presenter.
Okay, I am now unmuted. Thanks for pointing that out. Again, thank you, and wanted to say thanks to Mark and Barry for their opening comments. With respect to the New Jersey CEO Council, It's really in response to the pandemic, which has forced the healthcare industry to recognize the importance in addressing health equity. If we truly want to achieve favorable health outcomes, I'm confident with the leadership that Barry has provided and Mark is also will be providing. I believe that there is support for our organization as an anchor mission, and continue to evaluate the opportunities in which we can make a difference in the communities that we serve. As I said earlier, the New Jersey CEO Council is the state's effort to encourage employers to adopt an anchor mission. The intention and focus are in alignment with our existing efforts to hire and buy locally. Our system continues to be the leading healthcare provider institution in the state of New Jersey and a thought leader from both the clinical and service support that we provide to the communities around the state. As we look to continue the advance of our mission, which is enabling the communities we serve to have better health. Through the New Jersey CEO Council, the health system has been leveraged as an advisor. We've been engaged in the Pay It Forward Fund, as well as the Procurement Center of Excellence. We have internal experts, human resources, supply chain, and I will highlight Diana, engaged in providing guidance, insight, and strategy on the design of our programs to ensure that the programs are successful and benefit both our system and the vulnerable communities we serve. So Diana, without going on too much longer, I'll give it back to you. Diana, we can't hear you.
Sorry, I was muted. Apologies. So again, I'm going to provide a little bit of context in terms of what the New Jersey CEO Council is. It is, as Dr. Alexander alluded to, a state effort, and it was brought to us by the governor's office really late 2020, so it was almost early 2021. And the governor's office really had the intention to encourage employers to hire and buy locally. And so they tapped a select few employers, including RWJBarnabas, to commit and really help support their targets. So their goals really are by 2030 to hire 30,000 New Jersey residents. That is not to say that we, RWJBarnabas alone, are going to hire all 30,000, although I'm told that just based on our size, we could easily achieve that by 2030, but rather it's what is our contribution to that target. Also, their second goal is, again, as a collective, how do we spend $250 million? And so upon speaking to our internal asset leaders, we came up with some commitments and how we can contribute to both those goals. Next slide, 1 second. All right, so our hiring commitment, again, this was done through internal analysis by Marty Everhart's team. We actually decided to commit to 21,600 hires, again, by the year 2030, where 18,000 of those would be female, full-time and part-time hires, and 60% of those would be diverse. In addition, we would commit to hiring 3,600 male and diverse full and part-time hires. So again, the goal is a long-term goal. It's a 10-year commitment. And so you can see our progress to date. I believe Marty may be in this call. So if he wants to jump in and make any comments, but from what I've seen, we're well on track to reaching our goals by 2030.
Hi, Diana, it's Marty, and you are correct. We projected this goal in a much more conservative time frame of hiring than what our current reality is. So there is little doubt that we will exceed this target. What it says to us, though, is we need to focus more on those communities that have a greater need and really increase our pool from those communities to get them into our organization. Thanks.
Thank you, Marty. So this is the hiring commitment. In addition, the state also wanted to ensure that we were upskilling vulnerable communities. So while we're also doing some hiring, they created, and to be honest, it's still being built out, what is called the Pay It Forward program. So this it's really an evergreen fund. And the idea is, while it is asking the employers to do a one-time financial commitment towards this fund, it would provide training dollars for individuals. And once those individuals get trained and become certified and placed, they would essentially pay back the loan from this fund in an effort to really keep it sustainable. So again, there's a lot of nuances there because they have to make sure that, we're not creating a loan product that is unfairly, creating too much of a burden, financial burden for folks. And so as a result, there's a lot of partners involved. Social finance is actually the governor's and the state's intermediary. So they're the project management firm. You also have an entity called Mohila, and really they're going to be the ones that are designing, again, what that paying back looks like to ensure that, the fund can be sustainable. You also have the Higher Education Student Assistance Authority involved because they want to make sure that we're providing all the student aid that's available to students before we tap into this evergreen fund. And again, there's a lot of government entities that are supporting this effort with the state to ensure that it is successful. I will say that from our end, we obviously were going to contribute to the fund. We created an agreement with metrics because we wanted to make sure that the monies were earmarked specifically for healthcare roles. The state is creating this fund with the intention to support the healthcare sector, the green energy sector, as well as the tech sector. And so we want to ensure that we are, in fact, contributing to, again, creating the pipeline as it relates to healthcare. We also ensured through the HR and workforce development team that we were encouraging the state to look at credentialed roles. And that is super important in healthcare, right? As we look at living wage jobs as well, because we don't want to just provide low skill entry jobs. We want to make sure that we are providing those career ladders and that folks can in fact pay back, right, the training dollars that were borrowed against. So next up, the New Jersey CO Council also has a procurement element. And so as you notice, there's that commitment for all employers to contribute to the $250 million. They've also stood up a procurement center of excellence that is actually housed under the Rutgers Business School. So the idea is, again, to create a learning collaborative to sort of share the different local and diverse suppliers among employers, connecting with the chambers of commerce, creating more network opportunities. And further down the line, they do want to create some more investments and connections to venture capital funds. So we also have a lot of parties involved in that procurement center of excellence. But as I said, a lot of these things are still in design, but they are growing, and as we go along, we'll learn more. Okay, so our supply chain folks actually advised on the goal as it relates to procurement. The target really is to increase our local and diverse spend to 8%. So you'll see there where we're at in terms of our New Jersey spend, and then how much of a percent is really, those are certified small and diverse businesses. So when we say diverse businesses, those are the ones that are providing certifications as a small business, woman-owned business, veteran, and minority-owned. I think supply chain is on the call, so if one of you wants to provide any context or feedback in terms of how we're doing, that would be wonderful.
This is Phil Maneri, part of supply chain over contracting. So one of the things I think you have to keep in mind here, the numbers that we're presenting are strictly our tier one spend. We have a lot that we're doing through tier 2 that we haven't yet captured. So while the numbers are there, I think that we have to give ourselves a little bit more of a buffer here to understand that we still have a piece of this that we have to kind of contribute to show how we're doing overall. I think we are meeting the target. Some of the things I think you're going to see today are going to show you how we're going to advance these numbers, because we truly do have a great system in place, which is the first in the state. So that's just something to keep in mind as you look at this.
Great. Thank you so much, Phil, for your comments. All right. So next up, again, this is just to provide you some overview, but there are still some changes as it relates to the New Jersey CO Council. They recently announced that this council will actually be headed by Choose New Jersey, so it will be housed under Choose New Jersey. Again, they're seeing it more from a capacity issue. They want to make sure that they're providing the right resources for us to function and create sort of different offshoots and committees. And so they realize that, you know, while the state can do what it can, it's probably better suited to be nested under the Choose New Jersey organization. Again, there'll be more to come, but I think that's an exciting opportunity because Choose New Jersey does a lot with attracting businesses and innovation and research. So I think that's going to be really a good thing for us in the long term. This is also an opportunity, again, for all our asset leaders to really contribute to these goals that we've already made to the state. They're very public, right? There is a lot of external facing documentation that we've, raised our hand and said, we can do this because really we can. We have already been doing this to begin with. And so this is just really adding on to our portfolio as it relates to our anchor mission work. And with that, I will wrap it up. If we have any questions for me or for any of the speakers, I'm going to give a few moments before jumping on to the next presentation, which is the IT team.
Hi, Diana. Thank you. Phil, a question for you. You mentioned tiering. Could you kind of explain what that tiering is? How is it done? Is it based off of, financials? How would you define the tiering?
It is. It's in its most simplistic definition. Our tier 1 is our direct spend. So how are we directly working with these small, local, diverse businesses? So that's the first level. The second level is we do have larger relationships with larger companies that also have commitments to the same program. So they do have a footprint within the state. So we spend X amount of dollars with those big businesses, and they in turn are getting their supplies or their resources from these smaller businesses. Okay. So the more that we commit there, the more they can influence that spend. That tier 2 type spend is what we're focusing on to see if we can start to get a better understanding so we're able to report that forward as additional commitment to the state.
Thank you.
Absolutely.
Diana, it's Barry. I hope you don't mind me saying this. If you look at the other names on the CEO Council, you'll see that we are the only healthcare provider that was asked to be on this council. These are significant international companies. And I have to say, the reason we were asked is because of that which all of you do. You have built a healthcare system that's committed to all of these social demands, and you've established an anchor institution strategy that is leadership level. And when I would attend these meetings, there was clear indication by my colleagues who are CEOs of, as I say, significantly sized publicly traded companies, that the progress that we have been making and the manner in which we're addressing this is truly leading the pack. I have to say, and this is an editorial comment, one of the reasons we're being, quote, merged into Choose New Jersey is some of our more obvious competitors were a bit jealous that our organization was the only one to have its name on that list. And so now through Choose New Jersey, we'll see some more familiar names in our industry. But you should know that your hard work not only has helped the communities, but it has propelled our organization to a level of stature that's equal to these well-known international names when it comes to this area. So I congratulate you on that.
Thank you so much, Barry. Appreciate your comments. Certainly, I've been saying for a long time that we are the leader in terms of being an anchor institution as it relates to the healthcare industry. No one else in New Jersey is really doing this. A lot of folks are focusing on, you know, those initial screenings that we talk about with social determinants, but when it comes to actual making the investments and changing our operations and redesigning how we purchase and hire locally, we're really ahead of the game. So thank you for those comments. All right, so moving up ahead, we do have the ITNS folks presenting. I believe Bob Irwin was unable to attend, but fear not, because we do have Angelo Chatone, and so I'm gonna kick it over to Angelo.
Thank you, Diana. Yeah, all right. So we can go on to the next slide. There you go. One more. So today we're going to review the ITNS minority spend, what the donations that we made to the community over the past couple of years, our local diverse hiring, and our progress in the development of the new local vendor portal, which Phil alluded to a little earlier. Next slide. This is the dashboard that we created to manage, or at least review, the minority spend. We wanted to make sure we had a good focus on what we were spending on, the departments that are working with those local minority vendors, and make sure that we kept track of it as closely as we could. Next slide. So just to point out that over the last couple of years, we started this initiative at the end of 2018 to 2019, and we have progressed nicely over those last few years. I will note, though, that the EPIC effort has gave us a tremendous bump in 2021, and I expect that to continue in 22 and into 23 as well. So we're doing, I think, a pretty good, decent job there in getting some of these local vendors engaged. Next slide. There we go. I just wanted to highlight a couple local vendors that we deal with. SICI is our reseller. We buy most of our computer equipment from them. They're headquartered in Somerset, New Jersey. It's a women-owned business, and we spent a little over 12 million with them. It says 12K, but it's really 12 million with them in 2021. Diverson is a local IT staffing company located in Red Bank, and they provide application analysts and project managers for key applications that we have within our system. And in 2021, we did a $1.9 million spend with them. And the other company we use that's local is Back to the Future. They're a computer recycling company headquartered in Franklin, and we did a little over 200,000 spent with them. But this is just to highlight that we have from large to small vendors that we're dealing with locally. Thank you. On the community donations, over the past couple of years, we've donated a little over 107 laptops. These are older laptops that we refurbish and send out to the community. Next slide. All right, working with the social impact group, we've identified certain areas, and these are the facilities that have donated the laptops. And in 2020 and in 2021, we donated 7 laptops, and I believe we're going to discuss more laptops that we donated this year right after this presentation. All right, our diverse and local hiring. So overall, the targeted zip codes our local hiring is about 5.7%, excuse me. And I want to highlight 2 areas where we've done, I think, probably a little bit better than overall in IT. So in clinical informatics, this is the team that is kind of the liaison between our operations folks and IT. And in 2021, we hired 50% of the new hires were from those ALICE zip codes, those targeted zip codes. Service management, you guys are all familiar with it. These guys are our field service guys that come out and help with our desktops and laptops. And we have 15% of our new hires were from those zip codes as well. In addition to the new hires, we also have instituted a program with NJIT to to partner with in developing an internship program. The internship program is in two phases, either a 12 or 6-month program, depending on what the student is enrolled in at the school. Last year, we did 2 internships, and then we actually hired one of those interns into an open position in our security department. Next slide. All right. Any questions so far on the spend, the donations, and the? All right, very good. Next, we want to talk about is our local vendor portal. So Diana approached me several months ago with the idea of putting this together, and we put together a team, and I want to mention that team. It's Phil, Adrian from our supply chain. We have Rich Seta from marketing. We have Imran and Pavan from our IT team to help put this together, and they've done a great job so far in identifying it. So the goal in putting this together was to make sure that we have a way to identify local and diverse vendors, to make sure that we promote any contract opportunities that we have, which we're going to provide. Looking at a second phase to our program. We want to get it launched and then add additional functionality. Leverage any state or community data that's available, so to kind of get a jump start on getting that program going. And then, of course, support our local business with resources to mutually benefit RWJ and the local community. Next slide. There you go. Thank you. All right. So the local vendor portal, we're looking to create some search functions that would allow us to search on business name, category, and location, so that when we make this available internally to our staff, they have several areas on which they can search on. If they're looking for a local florist, they'll be able to go by category and they'll be able to find it. Excuse me. So the potential for new and local vendors, in addition to existing vendors, we're gonna allow the vendors to go onto the bridge and be able to register their information onto the bridge. And then I'll explain that process and how we get that information over into PeopleSoft in the next slide. So when we looked at the workflow, we wanted to make sure that it wasn't too intrusive on the way we do things today. So we want to really incorporate the way we look for local vendors within our current workflow. And I think that with the design that we come up with accomplishes that. This way, if it doesn't make it too intrusive, they're more likely to use a local vendor and make it easy for them to find them. On the bi-directional, we want to make sure that we, as I said earlier, when we post, if we have any contract opportunities, we're going to post it on our website and allow the local vendors to register for that opportunity. That may be a little bit of a phase 2. We want to get the basic program up and running, and then we'll add that feature a little later. Any questions so far? All right, next slide. All right, so the new so SI Connect is a program that actually Imran's team is developing that is going to be the intermediary between our website and PeopleSoft. So Imran, are you there? Do you want to speak a little bit about SI Connect?
Yep, I'm here. You guys can hear me, right?
Yes.
All right, cool. So, so SI Connect, Social Impact Connect, right? So that's the piece of solution that we're developing that is going to help us connect the information collected from the public website, where the local vendors will go and they will provide that information, bring that information over and take it to the supply chain team headed by Adrian, and let them kind of, review the information, make sure that the information that we do need, all the information is there. If, they need additional information, then, provide them, some software controls where they can reach out, automatically back to the vendor and ask them that, you're missing like this and that information. And then local vendor would be provided a secure link to log in and provide that missing information so that Adrian's team can continue their review process. Once all the information has been vetted, at that point, they will approve the information. It's gonna be sent over to the PeopleSoft. So this intermediate piece, that is like totally custom development that the development team is gonna be doing, and the entire development is gonna be taking place in-house.
Thank you, Imran.
You're welcome.
And the vendor vetting process, that's part of Adrian's team. And I'll let Adrian explain what the process we're going to go through to vet these vendors, make sure that we are able to do business with them. Adrian, you're on mute.
Imran, thank you, Angela, for the great work that you guys have been doing and supporting us in this. As both of you just mentioned, we're trying to create a vendor repository that's available to all employees within RWJBarnabas, so they can easily identify minority-owned vendors, local vendors, and small businesses. We've done a lot of work to try to figure out the best way to have a lesser impact on our current vendor ad process, and mainly keep the integrity of our current vendor ad process, but at the same time enrich it and provide more visibility and more data categorization and searchability to the portal. So once the vendors go into this public portal, they will fill their information. It's going to stop for my team to review that we have the correct licensing or paperwork that the vendor requires to be a minority owned, a certification from the state of New Jersey, and things of that nature. We'll review it and we'll keep it in a repository for our end users to select these vendors during the RFP, RFI process. Once the vendor is awarded a project, we will be going through the regular process without interfering the data integrity that we go through today. We'll add the vendor with all the information or all paperwork that's necessary, the appropriate contract, into PeopleSoft, and enable the vendor or enable the user to create a purchase order, and ultimately we can pay the vendor without any issues once the project is completed. So that's a workflow that's very extensive. We are trying to do this without additional resources, and leveraging technology has been great help, and working with Angela has definitely been a great experience. So thank you, everyone, and any questions I'm happy to answer.
Sure. All right, so let's talk a little bit about the general workflow. Can we go back to the other slide? Just want to cover a couple more things. So the overall workflow, as we just described, is that the vendor will come into the website, they'll register their information. SI Connect is where we do the vetting piece along with PaymentWorks. That's the official way for us to set up the vendors within our system. And then that vendor will be fed into PeopleSoft once it's fully vetted. And that once it's in PeopleSoft, we're looking to develop a new tile within PeopleSoft that will allow our internal users to go in and search for local vendors. And then once they find the vendor that they want to work with, they can either they'll be calling Phil to do a contract, get a master agreement in place, and or get the any final steps needed to get that vendor set up. We've enhanced our external website to capture some additional information. I think the original website we had some basic information, but we needed more in order to make this a more functional program. And we're going to have search capabilities that from the bridge and within PeopleSoft itself. So we'll have a link right from the bridge that'll go right into PeopleSoft, so that they can, in whatever venue you're using, you'll have access to that information.
We do have a question.
Yes.
From Sabina. Will the vendors already be vetted to meet our vendor requirements?
So that's the process that Adrian's going to go through. Once they register, the vendors will be vetted to meet our vendor requirements.
I just wanted to highlight the vendors will be vetted to make sure they have the appropriate documentation that qualifies them as a local or minority vendor. If the vendor is able to do the task or the project that we want to include them in, that's going to be a revision of the subject matter experts during the RFI or RFP process.
Adrian, is it difficult to get the necessary documentation to prove that you're a minority or women-owned business?
The vendor usually, or when suppliers log into the portal, they should have these certificates from the state of New Jersey or other states if they're minority vendors. There is a process that the state has to get their certificates. I'm not familiar with that. I'm sure they require paperwork on who owns the business, and that might take a few weeks or maybe months. But once the supplier has that, we're only going to review that that's a valid certificate, and move the supplier into our repository of vendors where they can be selected and awarded a project.
Thank you. I just want to be sensitive to the notion that a minority-owned business might not know how to get that certificate or would need help. I know we have an inventory of names of businesses. If there are any tips that we could communicate to them on how to, in fact, make sure they have up-to-date certificates, it might be helpful, but it's just a thought.
Barry, this is Phil. Just to give you a little idea, the concept behind the portal is to be self-serving on two sides. One for us as an organization, the other side for the vendors. We have to make sure that the vendors know what we want and how to work with us so they can be successful in bidding on these projects. So there will be links to help them get the information to make sure they have their certificates. You know, we have tried through the state database and the MTA databases to cross-reference our vendors so we could obtain the certificates that they may or may not, well, that they may have. And it has been challenging. One of the things we'll talk about a little bit in a couple of slides here is the work that we are actually moving forward with the state to actually have a vetted, certified database that we can tap into.
So if I could jump in, this is Diana.
Okay.
Barry, we are well aware of that, which you had just addressed. And actually on the next slide, if I could jump forward, I have a solution. To your point, not all vendors are aware of the certification process. So while they might be eligible, they just don't know. So in an effort to educate our small businesses, our local vendors, we actually created a resource hub on the new Buy Local website, where it provides, again, information as to where they can certify. And if they cannot do it directly online through that link, then they can partner with one of our community partners, the Small Business Development Center, which provides technical assistance and handholding to ensure that they can successfully complete that certification. So all that information, again, now is externally facing. Previously, it was not. So to your point, there was the challenge of, well, where do I get certified? Am I eligible? We actually have all those questions, those frequently asked questions on there as well, so they can see if they're eligible or not. And then lastly, I will add that the state used to have I believe it was like $100 fee, but there used to be a fee to be able to certify. The state has waived that. So there is no cost now to ensure that they are certified as a diverse business.
Adrian, Phil, and Diana, thank you. That really answers my question. I appreciate it. Thank you.
Great. Thank you, Diana. And as you can see, there's a link there, right there. It says register your business. Once they click on that, then go to the next page. And they'll get this screen for the vendor to go in and, oops, next page. Yeah. So they'll see this screen so they can register their business. Right. I know it's an eye chart. I apologize.
Yeah, and the other thing, if I could add, In our website, you also notice that we included some information on the prompt payment policy, because we realized that was also an issue area where folks that were certified didn't know that they were eligible for this benefit that RWJBarnabas provides to small businesses. So there is that information as well, that if in fact they are able to provide us with a small business certification, then they are able to get paid within the 30 days. All right.
Next slide. So some of the things we've done, and actually we're well into these steps here. The workflow is already completed. We did have an initial meeting with marketing to talk about developing a communication plan, both internally and externally, so we can get the word out to the vendors that this is available for them to go to our website and start registering. And over the rest of this month and next month, we're going to be building out the rest of the environment. We're going to test the system in May, and with our expectation to go live in early June. Any questions? All right. So next, there we go. Future considerations. And Phil, I know you're excited to talk about this, so I'm going to roll it up to you.
I am, but you have to understand why. I think Diana and I are both very excited because, you know, we're like kids at Christmas right now. This is actually the final piece to really make this a system that's going to allow us to create sustainable growth in the communities. You know, we had to go through an incredible journey to get here. We had to understand how to rethink, you know, our big business mentality. You know, how do we get down to a level that we can actually, you know, work with these vendors and redoing things as Diana had mentioned, payment terms and contracts, and rethinking bids and RFPs was our first step. The next, we had to figure out a support system. You know, how do we get these vendors to strengthen their abilities to work with us? And we were the first group to pilot a cohort through the Ascend Newark program. You know, we developed an educational system that will give vendors the abilities to create project plans and to do the things that we need them to do. You know, and from there, you know, we're about to launch the second cohort. We've been training, as Barry pointed out, all of those companies that are on there. We sit down with Prudential today, helping them develop their first cohort. So we've made giant steps in all of the progress to create this system to lead to that goal. I think, you know, we had to understand as an organization what our landscape was. You know, through the incredible work that Adrian and Supply Chain Analytics did, you know, we've been able to aggregate our data. We've been able to categorize it and segment it. So we know what we're doing, where we're doing it, and how much we're spending by vendors, by service lines. So we're able to really understand as an organization what our footprint is. The next step is, how do we identify the opportunities and how do we tie those opportunities to the vendor community? And this portal is the thing that does it for us. It allows us to now be more fully integrated with our communities. It allows us to tie to all of the collaboratives that are out there who are still trying to figure out how to categorize our data. You know, I think about 2 years ago, we grabbed the bull by the horns and said, listen, keep doing what you're doing. We're going to push forward on our path and we'll happily take you along. The state stood up. They heard us. They recognized that. And now we're leading into this part, which will take us into the future. And that future is with the state. We're working with Rutgers right now to develop their database, which is over 5,000 vendors that they have been working, you know, to certify. They're making sure that all the necessary paperwork is there. Now we're through the graduate program at Rutgers University, the business school. You know, we've gotten some graduate students who are now working on the ability to integrate that database into the work that we're doing here. And we don't have 5,000 vendors running into our system. I mean, I think Adrian wouldn't sleep anymore, but we need to find, you know, how do we know more than what we know today? Who's out there? Who can we extend it to? Who can we invite into RFPs? Or, you know, what flower shop can we run and get, you know, birthday flowers sent to somebody in the hotel, in the hospital, in the hospital. But we have to start to think about these things. And this portal will close the last step for us that will allow us to push this as the first prototype of a fully closed system. We can work with the vendors, we can help support and educate the vendors, we can identify opportunity, and we can tie all of that back into what's available that can be created as sustainable growth in the market space. So this truly is phenomenal work, and it's brought us, as you've heard several times today, way ahead of the curve with anybody else. We are being looked at as the experts in this area and being asked, help us get something like RWJBH has up and running. So it is really exciting, and I'm just waiting to see the results of what all of this will bring within the next couple of months. So I'm confident we've got a really great program in place, and I'm very excited about it.
Thank you, Phil.
Absolutely.
Next slide. That's it. We're done. Coming in June. Keep a lookout. Thank you all. Appreciate your time today, and let me know if you have any questions. Okay.
Thank you so much, Angelo. Again, folks, this is, I'm going to call it kind of like an internal Google for our employees and staff, except, these businesses will have those certifications and undergo a basic vetting process. So rather than, calling me for a minority or local vendor, or, calling Phil and really looking up on Google, reading blogs, who's a minority-owned business, who's a woman-owned business, this will actually facilitate that process so that anyone who is really, looking for a local and diverse vendor has the ability to do so. And again, it's really leveraging technology to help us in creating a much larger impact and hit our targets. So thank you, team. Oh, and in case you're wondering what they shared, there's a lot of technology and workflows on the back end that have to happen. So while it might seem straightforward, trust us, there's a lot of technicalities that need to occur for us to stand up this portal. All right, and with that, next up we have a presentation from Monmouth Medical Center Southern Campus regarding their laptop donation program and how it has benefited their local community. Kelly DeLeon, our social impact lead at the Southern Campus facility, will be sharing her experience.
Thanks, Diana. Good afternoon, everyone. As was mentioned before, we were the recipients of a laptop donation from Corporate IT, and I wanted to give you a little bit of background about the organizations that we shared these donations with, so that you can get a sense of the joy that we had in being able to share these with these community partners. Next slide. So the Kensho Karate program has been in existence for 9 years, and they have been a part of the campus here for that time. It's run completely by volunteers. Most of them are retirees who are black belts and karate masters. It was created in an attempt to protect youth and create a safe environment for kids here in Lakewood. It's open to children 8 and older and their families. The directors of the program invite parents to participate as well. And we have provided space to this organization throughout their existence. Recently, in early 2022, we committed to providing financial support to the program. So the program actually was looking to reboot and recruit new students, and they didn't quite have the funds to do so. And to do that, they needed funding to purchase uniforms, equipment, and some other things that they needed to have classes. And so through the connection with our VP of our foundation, Denise Gaffney, and a local vendor, which is Pine Belt Subaru, we were able to provide some financial support to Kensho. You can see in the pictures on the slide the moment that the official moment that we presented them with a check for their program. And then there's the picture on the right with the children in the room sitting down They had a demonstration event that we helped support. We contacted all of our community partners and let them know that they were going to be doing a demo program in an attempt to recruit students so that they really could grow their program with this new equipment. They had 50 families show up to their demonstration event. And if you recall, in mid-February, we had a lot of chilly Saturdays. This one was particularly chilly and windy and rainy, and families came over on foot for this event and signed up to be students of the program. So we have a bit of a good problem now. This program has exploded and they have a waiting list, and they're working on a solution to be able to accommodate those on the waiting list. Next slide. So I want to share that during the pandemic, we were able to give this group laptops through the corporate IT donation. We were told by the director of the program that students, they were offering Zoom classes during the pandemic, and students did not have the technology at home to be able to connect to their classes. In fact, we heard a few stories where kids were calling in and they were on the phone and they couldn't see or they couldn't be seen, and the instructors knew that they were there and they were just teaching to the phones. They were only having audio instruction. So we were able to give these laptops to these families while the program was held remotely, and students were able to remain connected or get reconnected to the program. And it really helped to bridge the digital divide for these underserved families who didn't have that technology in their home. So they not only were able to connect to the classes, but it benefited their household as well. Next slide. And then we just captured a few photos of the children receiving some of those laptops when we were able to give them out. Next slide. And now I'm going to pass off the next few slides to the Regional Director of Community Health Social Impact, Jean McKinney, who's going to explain our relationship with the Greater Bethel Church and the upcoming laptop donation to them.
Thank you, Kelly. Kelly and I wanted to put in context the importance of these donations. These were not one and done gifts. And to Barry's opening remarks, he said it best. It's about building collaborative relationships and long-term partnerships. And with Greater Bethel Church, our relationship began in 2017. A new pastor was assigned to Greater Bethel Church, which is an African-American church in the heart of a broken, impoverished, and often violent neighborhood in Lakewood. A shift in demographics happened over the years, with most of their congregation moving away and some of them returning for church services and community work. The pastor himself and many of his congregation now live outside of Lakewood, but return and have pledged to help those that are in the neighborhood now, who are mostly Hispanic. Pastor Jones recognized that faith-based organizations play an important role in a safe neighborhood, so he has partnered with a local minister from the Hispanic community so that he offers his church the services there now. And in 2017, this was the same year that the system adopted the social impact and community investment practice. And it was at that time that Kelly established a relationship with this new pastor. And it began with a small event called Unity in the Community. It was, I believe, his first event to, let the community know that they were there and open to serve. And it began with employee-led drives, school supplies, backpacks, toiletries, food. And ultimately, in the pandemic, it led to greater support through corporate and through the social impact initiative of donated PPE, MRE for the homeless, and ultimately the common market food supplies. And what we realized is that we had a shared vision, one that aligns with our social impact practice to meet the needs of those beyond the walls of our institutions. Next slide, please. In 2019, we invited Pastor Jones to be part of our Community Health Needs Assessment Advisory Committee, and he and church members participated in our minority focus groups to get a better understanding of what the community needs were for us to write our implementation plan. And it was during this process that we learned of his short-term and long-term goals. His short-term goals and immediate goals was to really feed the homeless that were living along the railroad tracks in Lakewood, establishing a Code Blue site, and creating a community pantry for people to come that they can walk to. He accomplished all these goals with his congregants during the pandemic. His long-term goal was to restore a freestanding building that had 4 classrooms in it that are on the grounds of the church. And basically it's to provide a safe haven for children and families, for after-school programs, for job and skills training, and for fitness and health education. And part of this goal was realized in August 28th, of 2021, when he unveiled his newly renovated space with tours to the community. And you'll see in these photos here, we were fortunate to have our president and CEO, Eric Carney, join us for the day. It was a hot, muggy Saturday day with storms threatening, but Pastor Jones said, God opened the skies and gave us blue skies that day. And we participated, and Eric was very impressed with what he saw. Next slide, please. He was so impressed that he made a financial commitment with a formal agreement to further the work of what we could do together. So we have a 3-year financial commitment of a total of $45,000. It's an unrestricted gift because this building is now just a building. It needs furniture, it needs equipment. Pastor Jones wants to put a library in there. So this will allow him to meet that dream, and we can partner with him together. Next slide, please. So the donation of the laptops to the Resource Center will enable us, along with church leadership and trusted community partners, to really provide educational opportunities in the future for families. We hope to create a youth workforce development program with them, partnering with some of our other partners there for job training and obviously health education. And this is the big thank you. This is where we thank our internal partners, because we would not be able to do this for our community partners without the support of our leadership. And it starts with Barry and our RWJ leadership for continuing to invest in our social impact practice. Dr. Alexander, Barbara Mintz and her team for all the work that they do with our social impact program. Diana Candelajero for her resourcefulness with the laptop initiative. I know that we drove her crazy often about, making sure we had the laptops and for it. And last but not least, but our IT corporate team for providing the laptops, and our local teams, Ray Duarte and James Tanzi, for securing the software and the operating system, the office software and the operating systems from Databit, one of our vendors, who donated it for this recent donation. So without all of your help, we could not make it possible for these children in the community. So thank you. We really enjoy doing this, as Kelly said.
Thank you so much, Kelly and Jean. Listen, you don't drive me nuts. It's part of the job. And I really want to thank the IT team. I know this was an initiative that Bob Irwin had brought up, and it has grown. But again, it just shows the innovation and the creativity of, rather than throwing out, laptops because our employees are getting upgrades, how do we repurpose those? Right? We provide the new hardware, and they're still good computers, they're still good devices. And then how do we share those across the communities most in need? So I thought it was an incredible idea. And again, I do want to give a shout out to Bob Irwin and his team for pushing this along.
Diana, it's Connie. I want to make a statement or comment. This is so thrilling to me because about 15 years ago, the Institute for Prevention and Recovery got a prevention grant from the state to start the karate program for Lakewood youth. And then Bob Goldschlag retired, and what he continued to do. And Kelly, thank you. This sharing is so important because the system support allowed that program to continue when we no longer had those grant dollars. So this is just outstanding and thrilling, and thank you. Good news.
Thank you, Connie.
We had a question, but I think it's going to be answered offline. Thank you.
Great. So if there are no more questions or comments for the Monmouth Medical Center team, we will move forward with the next item on the agenda. And I believe Lourdes Valdez, our Director of Workforce Development, will make some introductory remarks before we hear from our student. Lourdes, you might be on mute. I can't see you, but I also cannot hear you.
Sorry. Thank you, Diana. First of all, I'm very excited to introduce Thais Da Silveira. She is one of our medical lab technicians that will be graduating in December 2022. Thais has been a phlebotomist since 2017 at St. Barnabas Cooperman Hospital. She applied for the medical lab technician program we were offering through the Gaines Grant. She was selected out of 140 applicants and has been in the program since the fall of 2020. Thais has persevered through the challenges of the pandemic and continues her studies with Mercer Community College, along with her responsibility as a phlebotomist in our lab, which is and was, and it continues to be a heroic effort. The program is a 2-year associate program and prepares students for their ASCP exam. I want to highlight these students do not pay for any of their education. This is done through grants and partnerships with the Department of Labor, and if need be, tuition reimbursement, but that has not happened yet. The success of this program is due to our collaborative relationship again with community colleges and the ability to pivot the program by offering hybrid classes through the pandemic along with clinical rotations in our facilities. Additionally, we have been flexible with our students, but making sure they complete their clinical hours earlier by changing the clinical rotation to the beginning of the program. The program highlights our goals to work closely with educational entities, RWJ department leaders such as Alan Romanowski, and government partners to provide positive outcomes for our employees. I would like to say we currently have 21 employees in the MLT program. 5 have graduated, 5 have been placed, 8 are graduating in August. Already they're applying for positions and looking to be also placed, working closely with the directors of the lab. Along with that, the rest will be graduating in December 2022. I think we'll create a nice indent into our vacancies, and we look forward to continue our programs. We have many programs in place, but it is my honor to introduce Thais, who will share a little bit her story, and I think it best comes from her.
Hi, good afternoon, everyone. So like Lourdes said, this has been a long journey. I am a mother of 2 boys who actually graduated college themselves recently. So after I put them through now, it's my turn to kind of finish my part of the end. So that's very exciting. I've been at Barnabas for about 7 years now. I do work in the pathology department, and it's been a pleasure being here. I've been having so much support with this program, with Lourdes, with John, with Mercer, with the pathology departments, whether it's hematology, blood bank, every clinical that I'm going through, I pop into one of their departments and just kind of pick their brains. So they've been nothing but supportive. So it's a great program, and I'm excited. I'm looking forward to finishing strong now at the end of the year. So I'm in my third clinical right now. I go on campus once a week, which is 2 hours away from home. So it's tough, but it's going to be rewarding. You know, we do work here 10 hours at the hospital, but then after I leave here, I still go home and do 2-3 hours of homework. But it's well, you know, done deal for me. So it's a good opportunity, and I can thank you guys and the grants more than enough for that. You know, it's a rewarding, very rewarding. So, and you know, we'll be, like I said, graduating in a couple months, so we're almost there. We're at the end of the stretch line through pandemics, you know, but we're doing it with, like I said, with support of everybody.
I would like to add that this also is a great opportunity for frontline employees. The average the average increase is between $7 to $10 more an hour for those that graduate from the program. So that is very impactful. And Thais has been a star student. All I hear is about she passed hematology recently, so congratulations, Thais.
Thank you. Thank you.
I'm very excited about that.
Yeah, right now I hold about a 3.8 GPA, you know, haven't been back to school in 20 years. It was kind of tough, you know, remembering everything, but it's coming back to me a little bit. So it's been fun. Fun and challenging, you know, but like I said, we're getting there. We're almost there.
Thank you so much, Thais.
You're welcome.
And Lourdes. Folks, this is a new segment. So we're, again, as I mentioned earlier on, we're trying to uplift our local highlights and local stories for you folks to understand, you know, how our corporate decisions and programming really impacts lives individually. If anyone has any questions for Thais, please feel free, or any comments while we have her on.
I'll just say congratulations, Thais. So it sounds like you're really enjoying the development, and I'm happy we were there to help out.
Yeah, I am. Thank you.
All right, if there are no more comments, thank you so much, Thais. Again, this is really, it really warms my heart to hear how our upskilling, our workforce development initiatives really can have such an impact on your life. And I know you are one of many of the students that Lourdes and John and Marty are certainly, you know, assisting in reaching their career goals. So thank you for joining us and for sharing a little bit about your story with us today. All right, so we're doing great on time, I believe. You know, this is our last segment on the agenda, so I will actually kick it over back to Barry to close us out, unless there are any additional comments or feedback as it relates to any of the presentations. Barry, the floor is yours.
Thank you, Diana. Thais, the last time I had a 3.8, I had to double the score I really had. So congratulations, that is really fabulous. I have to tell you, sitting here and listening to all the presenters this afternoon was such a source of pride for me. I think each of you presented in such a professional way, linking everything that you're doing to our mission, showing how it is that we can improve the lives of people in our communities, and at the same time understanding not only how complicated it is, but that it takes a team to do so. I think that I tried to put myself in the position of an external spectator, listening and watching your presentations, and I could tell you the distinction that the system you helped build has is truly a reflection of the work you all do every day and the manner in which you present the work that you do all day. If I have one reservation, it's that I wish we could make sure that all of our colleagues in the organization know all of this. It's always difficult to convey this information to people who are otherwise busy and distracted by other important things. And so one of the things we'll have to determine is how we can best share this incredible news and accomplishment with all of our colleagues, encourage them to not only participate, but offer suggestions and listen as they do so. So again, congratulations to everybody, and I look forward to more progress towards our mission objective. And I encourage you to please keep up the good work. And obviously, the extent to which I could be of any help, please don't hesitate to engage me. So once again, thank you all for your daily work, and in particular, your presentations today. Thank you.
Thank you so much, Barry. Appreciate your closing remarks. As usual, it takes a village to accomplish all that we do, especially as it relates to our anchor mission. I know it's not easy. I certainly push a lot of folks to think outside of the box and creatively, but again, we're just garnering more allies internally. I really appreciate the creative team, the website design team that really helped us revamp our buy local website. And again, to the IT team for letting me borrow some of their engineers, developers, and technologists to really build out and design what a vendor portal can look like for our system. With that, the next Corporate Anchor Roundtable will be slated, I believe, for the end of June. We will hear from communications. I know that they're working on several efforts for us. I've also suggested that we hear from some of our food insecurity efforts. I know we're doing a lot across the system, but again, we want to dedicate more time to dive deeper as it relates to our different areas. To Barry's point, this meeting is recorded, so we are sharing these report outs both internally and externally, and that's again to help us, really educate and inform our stakeholders as to what we're doing, because we do a lot. We document this stuff, but we really need to start showcasing it more for our, again, all internal and external stakeholders to know. So with that, I've actually finished a little bit, 12 minutes before, so I will return this time to you. Thank you everyone for joining. Stay safe.
Thank you, everybody. Thank you.